Welcome to Shrink by Quint. I'm Quint Bower, UK CP psychotherapist with over 30 years in practice, specialising in addiction and recovery. I'm also director of Cinema, a global AI video and animation agency working across healthcare, finance and technology. This mini-series is a step away from my usual focus on psychotherapy and everyday life. Here I've been looking at how artificial intelligence is reshaping healthcare, and today I want to explore what might be the biggest challenge of all: the global mental health gap. In some parts of sub-Saharan Africa, there is just one psychiatrist for more than 1 million people. In rural India, mental health services are almost non-existent. Even in wealthier countries like the UK, waiting lists stretch for months or even years. The gap between what's needed and what's available is staggering. The World Health Organization predicts that by 2030, depression will be the leading cause of disability worldwide, and we simply don't have the human workforce to meet that demand. So the question is obvious. Could AI bridge this gap? Could digital tools, chatbots, or diagnostic platforms offer something where nothing exists? That's the promise, but there's also a peril. If we impose ready-made technologies without listening to local needs, we risk creating solutions that look good on paper but fail in practice. So, AI. Could it bridge the mental health gap or widen it if it ignores culture and context? AI offers something extraordinary: scale. An AI system can deliver basic cognitive behavioral therapy through a smartphone app. It can translate therapy into dozens of languages in seconds. It can triage patients, flagging those at highest risk, so scarce clinicians can focus on them. In theory, this could transform mental health care. Imagine a village where no therapist is available, but an AI tool can provide immediate coping strategies or connect people with regional services. For a teenager experiencing depression, it might be the first time anyone responds to their distress at all. At Cinema, we've worked with international organizations trying to communicate these possibilities, and one thing is clear: success depends less on the sophistication of the technology and more on whether it fits local realities. A CBT script designed for London may not resonate in Lagos. A metaphor that makes sense in New York may sound meaningless in Nairobi. That's the risk of digital colonialism, exporting solutions designed for the West without adapting them for the communities they're meant to serve. Mental health isn't just a medical issue. It's a cultural, social, spiritual issue. AI has to adapt to that, not the other way around. So the greatest risk of AI in global healthcare isn't failure, it's irrelevance. I once worked with a young man from a migrant background here in the UK. He described therapy as alien, not because of the therapist's skill, but because the language, the metaphors, the body language didn't fit his world. What helped wasn't the model itself, but the therapist's willingness to adapt to meet him where he was. Now imagine an AI system trained largely on Western data. How well would it understand him? Would it interpret his silence as depression, when in his culture silence is a sign of respect? Would it know that his metaphors for pain were rooted in community rather than individual experience? This is where the danger lies. Without adaptation, AI could reinforce barriers instead of dismantling them. Take a real-world example. In Zimbabwe, the Friendship Bench project trained grandmothers to deliver basic therapy in local languages under a tree in a marketplace. It worked, not because the techniques were novel, but because they were local, trusted, and culturally resonant. AI will need to learn the same lesson. Technology alone isn't enough. It has to be humanized. So, can AI bridge the global mental health gap? Yes, but only if it's hybrid. Machines can provide scale, translation, and data, but humans must provide empathy, humility, and cultural understanding. The hybrid future isn't just about machines and humans working together. It's about global and local working together. A chatbot designed in Silicon Valley might provide the infrastructure, but the wisdom of local communities must shape the content. From my vantage point in psychotherapy, in my own recovery, and in my work at Cinema, the pattern is always the same. Innovation spreads quickly, It dazzles. But unless it roots itself in context, it risks doing more harm than good. The future of global mental health will depend less on the brilliance of their technology and more on the humility with which we deploy it. So the future of global mental health is hybrid, technology scaled up, but rooted in local voices. You've been listening to Shrink by Quint. I'm Quint Bower, psychotherapist, consultant, and director of cinema. This episode concludes my mini-series on AI in healthcare. For companion articles and more reflections on psychotherapy, sobriety, and technology, visit quintbower.com. Thanks for listening.